Do you know someone that has that wicked-looking brow lifting, or perhaps more likely someone whose brows sit a little bit low and seem heavy? Patients frequently come to me for a brow lift, and they pull their brows up like this to indicate what they want. They tell me they want me to put Botox in their forehead to accomplish this. So let's talk about this. I'm Karen Whitney, board-certified physician assistant at Advanced Cosmetic Surgery and Laser Center, and trainer for the Allergan Medical Institute. When I see a patient for Botox cosmetic treatment, an important part of the assessment process is really evaluation of the position and the movement of their brows. This includes two components or muscle groups, the glabellar complex and the frontalis. I look at how much the brow pulls down and in with frowning. These frowning muscles are depressors, so relaxing them allows the brow to lift slightly. Then I look at how much lift there is with the contraction of the frontalis or forehead muscle, which is an elevator muscle. Relaxing the frontalis keeps the brow from lifting and creating the horizontal lines on the forehead. If one brow lifts too much, it's fairly straightforward to relax the lifting muscle on that side for better symmetry. We work to achieve a brow lift by relaxing the glabella, which pulls down, and maintain lifting action above the brow by not placing Botox directly above the brow. So we're trying to relax the rest of the forehead, but not the portion that lifts the brow. Finally, the obicularis muscle around the eye pulls the tail of the brow down. So placing a unit or two into this portion of the muscle can allow the brow tail to lift. The success of the brow lift is really dependent on the inherent strength of the patient's forehead muscles, their anatomy, interaction of the other muscle groups in the upper face, and the amount of lift you can accomplish will vary with each person. So while some of my patients will have a very pronounced lifting effect, others will have minimal results. Questions? Reach out to me. Here's one topic you hear little about: filler for forehead lines. I'd like to share the reasons for this. I'm Karen Whitney, board-certified physician assistant at Advanced Cosmetic Surgery and Laser Center, and trainer for the Allergan Medical Group. So, forehead lines. First of all, Botox Cosmetic is the go-to treatment for forehead lines. But it turns out that for some patients, the combined loss of skin elasticity with skin aging, especially combined with the loss of cushioning fat under the skin, forehead wrinkles or lines may not improve, even though the Botox relaxes muscle activity. So we refer to Botox first rather than filler. Secondly, due to the vascular and arterial pattern in the upper third of the face, there's minimal collateral circulation. That means that if a vessel is blocked, there are not good alternate ways for the blood to flow. This makes placing filler into this area more risky for a vascular occlusion or blockage. Only injectors with a very high level of experience should offer this treatment. I do advise the patient that this is off-label or not FDA approved and carries a higher risk of complications. I typically choose a very soft filler such as Juvederm Volbella, which can be carefully placed just below the surface of the skin above the level of blood vessels, or placed on top of the bone below the blood vessels after making sure I'm in a safe space. Very small amounts of product are used per injection site, and the Volbella is smoothed with gentle pressure. I use this method for improving very deep lines and also to lift the skin above the brow bone if there's volume loss or hollowness in this area. So the takeaway here is that filler can be used in the upper third of the face. Extreme caution should be used and offered by an experienced injector only. And typically, it's associated with the ongoing use of Botox Cosmetic.